Muscles of the acromioclavicular, sternoclavicular, and glenohumeral joints. This will include rhomboid major, rhomboid minor, trapezius, subclavius, serratus anterior, pectoralis minor, pectoralis major, and latissimus dorsi. Rhomboids major and minor. Superiorly, we have rhomboid minor, shown in pink here, and inferiorly, we have rhomboid major. They have medial attachments on the spinous processes of C7 to T5, and more specifically, rhomboid minor is C7 to T1, and major is T1 to T5. And laterally, they attach to the medial border of the scapula. The rhomboid minor attaches near the root of the spine of the scapula, and rhomboid major attaches to most of the rest of the medial border of the scapula. The primary actions of both muscles include retraction of the SC joint. So this is retraction of the clavicle at the SC joint in the transverse plane along a vertical axis. And they do downward rotation of the AC joint. So that is downward rotation of the scapula at the AC joint in the frontal plane along an anterior-posterior axis. And rhomboid major only works on depression of the clavicle at the SC joint, which is a frontal plane motion as well. Rhomboid minor has a line of pull that goes almost directly through the anterior-posterior axis of the SC joint, which means it would have very little, if any, action at that joint. But rhomboid major does in fact do depression of the clavicle at the SC joint. Next we have trapezius. Trapezius is typically divided into 3 different sections. It may actually be at least 4 different divisions, but for all functional purposes, 3 divisions does suffice, and that is the tradition. So medially, the upper trap has attachments on the occipital bone, the nuchal ligament of the cervical spine, the spinous process of C7. The middle trapezius has attachments on the spinous processes of C7 to T4, and the lower trapezius has attachments on the spinous processes of T4 to T12. Laterally, they attach to the scapula and clavicle. The upper trapezius attaches to the lateral portion of the clavicle and the acromion process of the scapula. The middle trapezius attaches to the spine of the scapula, and the lower trapezius attaches at and near the root of the spine of the scapula. The actions of trapezius include retraction at the SC joint. This is the entire muscle. Elevation of the SC joint. So this is only the upper division. So the upper section of trapezius will elevate the clavicle at the SC joint. Then we have upward rotation of the AC joint. So that is upward rotation of the scapula at the AC joint, and that is only the lower division. So as the lower division pulls down on the medial end of the scapula, it tilts the glenoid fossa upward, which is upward rotation. And then finally we have depression at the SC joint. So the lower fibers of the trapezius also, as they pull down on the scapula, will have a moment arm or a torque that will pull down on the clavicle, which creates depression of the clavicle at the SC joint. Here we have subclavius, literally meaning under the clavicle, has a medial attachment on the medial anterior portion of the first rib. Occasionally you may see the attachment as the manubrium or including the first rib and the manubrium. Laterally, it attaches to the subclavian groove of the clavicle, and that is along the inferior surface of the middle portion of the clavicle. It has one primary action, which is depression of the clavicle at the SC joint. You can see the line of pull is medially on the clavicle, which will drive the clavicle into the manubrium. So it might also play an important role in stability of the clavicle at the SC joint. Serratus Anterior. So we have a medial attachment along the medial border of the scapula and a lateral anterior attachment on the lateral surface of ribs 1 through 9. You will notice that it's not completely anterior. I've included an anterior and posterior view. However, there are two other serratus muscles, serratus posterior superior and serratus posterior inferior, that are completely posterior on the body. Hence, this muscle gets the name serratus anterior. For actions, we have upward rotation at the AC joint. So as the muscle pulls laterally on that medial border of the scapula, the glenoid fossa starts to point upward, which is upward rotation of the AC joint. They do protraction of the SC joint. So with that same line of pull, as it pulls on the scapula, the clavicle itself would start to move anteriorly in the transverse plane, which is protraction of the SC joint. And then finally, elevation of the SC joint, and this is the one that's hardest to see. But because of the line of pull, as the scapula moves lateral and starts to point upward, it will also lift the clavicle at the SC joint, which is elevation of the SC joint. And if we go through full range of motion or near full range of motion, the inferior fibers of serratus do lose their leverage. They might actually gain leverage to do depression, but at least from anatomical position, the entire muscle can contribute to elevation at the SC joint. Pectoralis minor, which is deep to pectoralis major and definitely significantly smaller than pectoralis major, hence the name. It has a superior attachment on the coracoid process of the scapula and an inferior attachment along the anterior surfaces of ribs 3 through 5. It has two primary actions. Those are protraction at the SC joint, so in the transverse plane, as it pulls on the coracoid process of the scapula, it pulls the clavicle anteriorly in the transverse plane, which is protraction of the SC joint. And it has a downward pull on the coracoid process of the scapula, which will pull the clavicle downward, which is depression of the SC joint. You'll notice that it does not directly act significantly at the AC joint, and that is because the line of pull of the muscle goes almost right through the axes of the AC joint. Therefore, contribution to AC joint actions will be minimal. Pectoralis major, traditionally separated into 3 divisions. You'll often see a clavicular head, sternocostal head, and abdominal head. A lot of books will only list a clavicular head and sternocostal head. It has been divided into at least 7 different divisions, although functionally 3 divisions does suffice. The medial attachments include the medial half of the clavicle, the sternum, cartilage of ribs 1 through 6, and the aponeurosis of the external abdominal oblique. Based on the divisions, the medial half of the clavicle consists of the clavicular head, the sternum, and parts of the cartilage of the ribs make up the sternocostal head. And of course, the aponeurosis of the external oblique would make up the medial attachment of the abdominal head. They all converge laterally, so the attachment for all 3 divisions is along the lateral ridge of the bicipital groove of the humerus, which is also known as the intertubercular groove or intertubercular sulcus of the humerus. Pectoralis major has several actions because it can act on the AC, SC, and GH joints. It can do flexion of the GH joint, so this is action within the sagittal plane. medial or internal rotation at the GH joint. So this is within the transverse plane. Adduction of the GH joint, that is within the frontal plane, and horizontal flexion of the GH joint. So once the arm is flexed or abducted to 90 degrees, the entire pectoralis major can pull medially within the transverse plane of the body, which is horizontal flexion or horizontal adduction. The sternocostal and abdominal fibers only can act on the AC and SC joints. So they can do protraction at the SC joint in the transverse plane, depression of the SC joint in the frontal plane, and downward rotation at the AC joint also in the frontal plane. And our last muscle in this group is latissimus dorsi, and this goes from the sacrum all the way to the humerus. So it's going to have several actions, as it can act on the spine, the ACSC joints, and the GH joint. So for attachments inferiorly and medially, it attaches to the spinous processes of T7 to L5, the posterior surface of the sacrum, the posterior medial portion of the iliac crest, the posterior lateral surface of ribs 9 through 12, and sometimes on the inferior angle of the scapula. The attachment on the scapula I've seen in from different sources, typically around 30 to 50% of the time. Then superiorly and laterally, they converge on a single point on the in the intertubercular groove of the humerus, also known as the bicipital groove of the humerus. Actions of latissimus dorsi. Adduction of the GH joint. So the fibers can pull the humerus medially within the frontal plane. Therefore, they can do adduction of the GH joint. Downward rotation of the AC joint. So as those fibers pull inferiorly and medially on the humerus, they can also rotate the glenoid fossa downward at the AC joint. Depression of the SC joint. So that same line of pull will cause the clavicle to pull downward within the frontal plane. Therefore, they can do depression of the clavicle at the SC joint. Lateral flexion of the spinal joints. So the more inferior and lateral fibers have leverage to the anterior posterior axes of the spine. Therefore, they can contribute to lateral flexion of the spinal joints. Extension of the GH joints. So now in the sagittal plane, the fibers would have a posterior line of pull on the humerus within the sagittal plane. Therefore, they can contribute to extension of the GH joint. Extension of the spinal joints. So the lateral and inferior fibers also have a line of pull posterior to the medial lateral axes of the spine. Therefore, they can contribute to extension of the spinal joints. In the transverse plane, they can do medial rotation of the GH joint. So the line of pull goes along the medial surface of the humerus and wraps around the arm. So when it contracts, it pulls the anterior surface of the humerus medially in the transverse plane, which is medial or internal rotation of the GH joint. Then retraction of the SC joint, also within the transverse plane. So as the muscle pulls posterior and medial on the humerus, that would pull the clavicle posteriorly within the transverse plane, which is retraction of the SC joint. And finally, ipsilateral rotation of the spinal joints. So as the fibers pull medial and posteriorly on the humerus, That can also create a torque along the vertical axes of the spine, which is ipsilateral rotation of the spinal joints, meaning rotation to the same side.